each and all of these states are saying, yeah, the economy is so lousy under Trump, they can't afford it. Is that what it's really about? And is this a good thing? How does the man tasked by the president to run Medicaid and Medicare see that question? Let's ask him. Dr. Mehmet Oz joins us now. Doc, good to see you. Thanks for coming.
Thanks for having me on, Chris. Let's just address what's the obvious reality of going on with the 3 states you mentioned, and others will follow. It's very easy to be generous with someone else's money. So in California, for example, where there's over $6 billion over budget on Medicaid, in part because they're covering illegal immigrants, they were hoping the federal government would cover 90% of the costs because most of these illegal immigrants are able-bodied individuals, and so they can collect Medicaid. The federal government matches them at 90%. It's pretty easy for the governor to say, you know what, we'll put them on Medicaid, not a big deal. Someone's going to pay it for us. Same in Minnesota, where they actually ended up with 3 times more illegal immigrants enrolled than they expected. Of course, that busts the budget. Same in Illinois. So my job is to accomplish what the president has asked over and over, which is align the needs of the federal government with the states. If we do that together, we'll be able to help the most vulnerable Americans for whom Medicaid was designed to support. And that is the passion we all have here. Whether in rural America, urban America, underserved areas, we want to make sure that Medicaid is there for you. But if we extend it to illegal immigrants without keeping tabs of what those costs are, and especially if we have a system that encourages states to do legalized money laundering, to push more money towards able-bodied individuals, Chris, the dollar doesn't stretch that far. You end up bankrupting the whole system. And Medicaid has grown over the last 5 years, 50%. 50%. And we've got a fraud issue in the Affordable Care Act, the exchanges, that we think is about $25 billion. So we've got to clean up the fraud. We do that by getting governors to work with us.